Welcome to our series on managing patients with common ENT presentations. Today we're going to be discussing septal haematoma. Things that you'll need in assessing patients are a headlamp, a nasal speculum, gloves and apron, the blue spray, which is the lidocaine with phenylephrine, a 10 ml syringe with a 14 gauge needle. Key points to look out for in patients with septal haematoma are that the blood supplied to the nose lies between the mucoperichondrium and the septal cartilage. Damage to the nose may cause bleeding to this potential space, and this causes septal haematoma. This can cause avascular necrosis of the septal cartilage and may also be a risk factor for abscess formation. If left untreated, this can lead to septal perforation and cause a saddle nose deformity, as seen on this patient here. Untreated septal abscesses may then spread to the cavernous sinus and can cause cavernous sinus thrombosis as well. Key findings with patients with septal haematoma are any sort of history of facial trauma or epistaxis. They may have a history of nasal blockage or pain. The facial trauma itself may predate the presentation with a septal haematoma by several weeks. When you examine these patients, septal haematoma most commonly present in the anterior portion of the nose and are usually bilateral, but they may be confused for deviated nasal septum, so you'll want to palpate them gently with a gloved finger, where they'll feel soft and fluctuant, whereas a deviated septum will feel hard and firm. In managing patients with septal haematoma, you'll want to get a definitive diagnosis, and this is done by needle aspiration, which should take place following your assessment. When doing this, you want to make sure that you apply plenty of topical local anesthetic spray. Once you've inserted the needle and got your aspirate, you'll need to have a look at it. A purulent aspirate will indicate an abscess formation. You'll want to send a sample off for microscopy and cultures, sensitivities, and start the patient on antibiotics according to trust guidelines. And this includes IV antibiotics, and they'll need to be prepared for theatre to have a thorough washout. So at this stage, you'll need to escalate to your seniors. Definitive management of patients with septal haematoma is with an incision and drainage under general anaesthetic. Following drainage, patients typically have bilateral nasal packs and a corrugated drain in the potential space, and they'll need follow-up for the next 2 to 3 weeks afterwards as well. Useful resources include entsho.com and the Oxford Handbook of ENT and Head and Neck Surgery. I can't recommend these enough.
This concludes the talk on septal haematoma. Thank you very much for watching.